Hello, everyone, and welcome to Neurocracy. Today, we're joined by Dr. Michael McLeland, Director of Research and Neurodiagnostic Testing at St. Luke's Sleep Medicine Research Center here in St. Louis. With decades of experience in sleep diagnostics and neurophysiology, Dr. McLeland has helped shape how we understand and treat disorders like insomnia, sleep apnea, and circadian misalignment. Dr. McLeland, thank you so much for joining me today.
Yes, thanks for asking to talk to me.
Yeah. So, what first got you interested in sleep?
I've been in the medical field for quite a while before I got into, or a few years before I got into sleep medicine. I was a first responder, and then I got into like a radiology technologist. Um, and then I just happened, like most people in sleep medicine, I just happened to fall into sleep medicine. There was a job posting at Washington University.
Okay.
I wanted to kind of further my schooling, so I thought that would be a good match. And my first night working at the sleep lab, I was hooked. It was
Yeah.
great to see patients being diagnosed and treated and the way they woke up in the morning. And then it was my first night there. We had my first experience with REM behavior disorder.
Um,
And to see something like that, it really changes your perspective in sleep. And I had a really great mentor during my tenure at Washington University, Stephen Dauntley. He kind of pushed me
yeah.
to learn more about sleep and kind of create things at the university. I created a course called The Science of Sleep
Oh, wow.
for undergrad class, just to kind of get people interested and to know what sleep medicine kind of really was about. And then
Yeah.
he kind of pushed me into the research side of things. So,
That's super cool.
yeah.
So at St. Luke's Sleep Medicine and Research Center, what kind of studies or patients do you usually work with?
So uh, for research, we basically work with adults, and it can range from anywhere from obstructive sleep apnea to narcolepsy. Narcolepsy is really a lot of pharmaceutical companies are doing a lot of new medications coming out on
Yeah.
orexin agonists for narcolepsy. Um, and then hopefully in a couple of years, there'll be a medication for sleep apnea.
Yeah. So in the past couple of years, has there been any cool or interesting new technology, like advanced tools or techniques that have changed the capabilities of what your team has?
Yeah, so AI has
Okay.
is really pushing our field,
Yeah.
and it, out of kind of our comfort zone, I guess.
Okay.
In sleep medicine, we're so used to looking at signals, and we want to see everything. Sleep medicine is kind of pushing us out of that, but it's making our job faster, getting more patients in, getting diagnosed instead of waiting months and months. We're getting it, we can get them in and get them out diagnosed and treated a lot sooner
Yeah.
with AI.
Yeah.
And things are getting smaller. I still hear patients today in clinic. They're like, "Really, this is all I need to do?" We do, and the sleep lab will never go away. There's
Yeah.
going to be testing and stuff that it's going to be a while before AI or these wearables kind of.
I was actually going to ask, but that was going to be my last question, actually. So it's interesting to hear.
Yeah, so I don't
Yeah.
think sleep lab will go away.
Right.
It just kind of reminds me back in 2008, 2009 when um, auto PAP, auto CPAP was
Oh,
coming out.
yeah. Yeah.
Um, the sleep technologist and thought, their jobs were done at that point, and it's not. It
Right.
does take a kind of a science to do the titrations. Once they're, patients titrated, it's fine. And that was kind of sparked my interest. That was my first research project is looking at AutoPAP and comparing the algorithms to each other. So,
That's super cool. So, kind of building off of this idea of research, what has been your experience with advocacy about like awareness or for certain topics in sleep? Or I guess what has been your journey through that kind of side of things?
yeah, so I do a lot of community talks, and I always try to kind of get them to focus not so much on how long they're sleeping, because
Yeah.
I get a lot of patients will say, I'm in bed, I'm sleeping 8 hours, but it really matters just as how well they sleep than it does
Yeah.
how long they sleep.
Right.
So, meaning like the quality and structure of those hours. Sleep isn't one like long flat rate. We go through different stages of sleep and trying to kind of educate patients on that each stage of sleep that we kind of cycle throughout the night have like different responsibilities, right? So like deep sleep really helps with physical recovery, hormone
Yeah.
regulation, especially during puberty,
Yeah.
and then immune health, and then and then REM sleep, of course, really supports memory, learning, and emotional balance.
Yeah.
So it's
So
yeah.
yeah. Yeah. So, kind of building off this idea of advocacy here, have you ever like, or I guess, what is your personal connection with pushing back like school start times, and what has been your experiences with that locally, I guess, here in St. Louis, since I think we talked about this when we first met. So,
Yeah, so
yeah.
I do have a set of twins that are 14 years old.
Yeah.
So Edwardsville is we have sent out their school district. I live in Edwardsville,
Yeah.
Illinois, so their school district has sent out questionnaires and have kind of dabbled in school start times. I know Minnesota was really the spearheaded this. We're looking probably 20 years now ago,
Wow. Yeah.
and they saw significant results with graduation
Yeah.
rates and even grades.
Yeah. Yeah.
Uh,
I think I know the study you're talking about with the grades. Yeah.
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 Uh, so yeah, and I'm really trying to, since my teenagers, I'm trying to connect with them and really talk about, like, even sports teams, like professional sports, are hiring sleep educators to help their team progress better and play better.
Yeah.
Um, so yeah, it's been interesting, and I still think teenagers are the hardest kind of the audience to connect with.
Right.
Even with like trying to talk to my son, he fell asleep last night and he's like, I wasn't really asleep. I just had my eyes closed and I was thinking. And he's like, if I need a sleep expert, I'll make an appointment with you. So,
That's funny.
um, so yeah, there's still that mentality that the less sleep, it's better to brag about
Yeah, I
the
agree.
little bit of sleep that you get. No one's going to brag about, hey, I slept 10 hours last
Yeah,
night.
yeah. It's
You're
cooler to
you're
brag about, oh,
cool.
I only got 2 hours. Yeah.
Yeah.
Yeah, yeah.
So
Yeah. I mean, in the next couple of years, do you see kind of a bigger effort like being made toward pushing them back? I mean, with all the research kind of just continuing to pile on and advocacy efforts. So I recently, a couple months ago, got in touch with the state senator, Tracy McCreary, for kind of like the St. Louis area. So I've been trying to like get her or work with her to draft legislation to push back school start times in Missouri. And there's a nonprofit called Start School Later where they kind of have a reference of all like the legislation throughout the nation that's being made. So I guess the point of me saying that is I think there's a lot more like youth advocacy and like large scale efforts. So do you see that as something that's going to cause change?
yeah, and that's what's
Yeah.
going to kind of push change.
Yeah.
The education system in the United States is really slow in change,
Right.
and a lot has to do with because parents are you kind of attuned to the school start time, because they kind of work around their child's school,
Yeah.
and it provides some type of care for the child while the parents are gone, at work.
Right.
So, but I think, yeah, having students more involved and it's really affecting them. So I think having them involved will really push it
Yeah.
forward faster.
Yeah. So given your like years of experience in sleep and kind of the academia regarding it, what would you say is like one of the biggest misconceptions that you have to like say right here for people to hear?
Yeah, I think it kind of goes back to like, yeah, and we hear it all the time is like, you need 7 to 8 hours
Right.
of sleep. And
Yeah.
I would, yeah, we do, but there's
Right.
more to it than that, than the hours.
Quality, like structure. Yeah.
Yeah. Yep.
Yeah. So, what would you say is actually something that people can do right now to try to improve the quality and structure? Because I think we've kind of established how important it is to consider that, but what is something they can do to kind of try to address that like idea of getting better quality and structure?
Yeah. So that's a good question.
Yeah.
And I always, there's two things I always first recommend before anything is one, going to bed at the same time every night,
Yeah.
waking up at the same time every morning, even
Yeah.
on the weekends. so kind of have a structure to your bedtime routine, and then waking up in the morning. And second is getting you only using your bedroom for sleep. Get rid of the TVs, the
Yeah.
computers, iPads, phones. When I do my community talks, I tell them, don't charge your phone in your room, because the first thing people look at is
Yeah,
like the
definitely.
alarm clock. Like, don't even have an alarm clock on your nightstand. Put it underneath the bed if you need it to wake up in the morning. That way, you're not waking up and then causing a stress because you're looking at the time and you're not asleep, and it just kind of
Yeah.
creates a snowball effect,
Yeah.
and then it just leads into other nights. And so, yeah, um, them are the two main things I kind of really
Okay.
push them to
Yeah.
start with.
So I guess backtracking to the idea of like the sleep medicine center here at St. Luke's, like what are some like the biggest challenges you face when you're collecting data or running studies? Maybe it could be regarding like finding like trends in the data or simply like the logistics of studies themselves. So
So um, the most challenging is the especially with research is the amount of um, antidepressants or medications used for depression and anxiety, um, that really creates a hurdle for us when we're doing especially pharmaceutical research, because usually they don't want patients on these medications, and it's
oh
really hard because usually it's coming from their primary doctor, and it's because and it's kind of like what came first, chicken or the egg. Did the
yeah
depression and the anxiety come, or did you have some type of sleep problem before that kind of
yeah
caused um, so yeah, so it'd be um, and then it does affect us in clinical too, because then when we're trying to do especially for hypersomnia, if we're doing
yeah
an MSLT, we want to make sure that we're getting good clean data. The MSLT is kind of it's already limited, so if you add in medications and stuff patients are taking and trying to get them to wash out, it becomes more difficult.
yeah
So it'd be great if primary cares would first, if depression and anxiety is going to be a diagnosis, first send them to the sleep center, just to make sure there's no sleep problems, if they're not going to kind of screen for those.
yeah. And my final question for you is basically kind of building off of the idea of like I guess studies and research, like where do you think the sleep medicine field and as a whole, like with all the scientists and researchers throughout the world and advocates, where are you most excited about like the area it's heading in?
Yeah, so I think the technology will really kind of shape on the clinical side of
Okay.
how things are going to be done.
Yeah.
Um, AI is good. It's not the best,
Right.
but it's just going to get better.
Yeah.
Um, I think I'm hoping, and in my lifetime, I'll see a cure
Yeah.
for like narcolepsy, some of these more rare sleep disorders that patients really struggle with.
Yeah.
Um, but there's a lot more focus now on like circadian rhythms and um, in these sleep disorders than there was in the past. So uh, yeah, it's really exciting and I'm hoping education becomes more a priority for the public
Yeah. Yeah.
about sleep, because again, we're not told, we're not trained how to sleep. Uh,
Yeah, I guess it's just kind of your family. And then
yeah,
especially I think if you see like your parents with like weird sleep schedules, it just becomes ingrained at a very young age that it's like normal. So
right. Yeah, and so it's kind of a habit that you pick up,
yeah,
of
yeah.
sometimes usually bad, and then
Right. Yeah.
but if we can get the parents to kind of buy into it, and then
Yeah.
next generation will be better sleepers.
Yeah. Well, on that note, thank you so much for joining me today. I think we had a great conversation, and I was really interested by your insights and perspectives that you've gained over the years that you've
Thanks.
been in sleep. So, yeah.